This presentation is made for Didipio Community Development Corporation.
Dyslipidemia is the imbalance of lipids such as cholesterol, low-density lipoprotein cholesterol, triglycerides, and high-density lipoprotein. This condition can result from diet, tobacco exposure, or genetic, and can lead to cardiovascular disease with severe complications.
The consolidated result of the recent annual physical examination shows that out of 228 employees, a total of 104 were found to have dyslipidemia, which is about 46% of the population.
In short, dyslipidemia is the abnormal levels of lipids in the blood. What are lipids? Lipids such as cholesterol or triglycerides are absorbed from the intestines and are carried throughout the body via lipoproteins for energy, steroid production, or bile acid formation.
Some employees with dyslipidemia were also found to have other illnesses such as urinary tract infection, hypertension, diabetes, and other cases of heart problems and kidney problems. While some employees even have this multiple disorders at the same time.
Several health behaviors can have effects and increase lipid levels. Examples include tobacco use, physical inactivity, nutrition, and obesity. Specifically, nutrition risk factors include the insufficient consumption of fruits, nuts/seeds, vegetables, or high consumption of saturated fats. The prevalence of dyslipidemia increases with age.
Among the 104 cases of dyslipidemia in our employees, most of the cases were found to be among those in their 20s to 30s.
The primary evaluation tool for dyslipidemia is a lipid profile. A lipid profile or lipid panel is a panel of blood tests used to find abnormalities in lipids, such as cholesterol and triglycerides. The results of this test can identify certain genetic diseases and can determine approximate risks for cardiovascular disease, certain forms of pancreatitis, and other diseases.
After the examination, some employees were recommended to have follow-up laboratories and ultrasounds. We encourage you to follow up with these diagnostics to reinforce your knowledge and action plans for your conditions as well as to confirm your best treatment regimen. Most importantly, follow-ups help reduce chances of complications and hospital admissions. Initial management for dyslipidemia involves lifestyle modifications. This approach should include a diet with an emphasis on the intake of vegetables, fruits, and whole grains within an appropriate calorie requirement. Also, adults should participate in moderate to vigorous aerobic physical activity 3 to 4 times a week for at least 40 minutes. Some employees were advised to take a special kind of diet. Low-fat diet encourages consumption of certain foods such as fruits and vegetables, whole grain and dairy products, while avoiding fried foods, fatty meats, butter, and refined oils. Low carbohydrates diet is more on dry fruits, eggs, non-starchy vegetables, and wants you to avoid refined sugars, white bread, white rice, pasta, and others. Diabetic diet helps stabilize your blood sugar and includes foods such as beans, dark green vegetables, tomatoes, sweet potatoes, and whole grain among others. A low purine diet is often prescribed for people with high levels of uric acid in their blood. This avoids beer, alcohol, red meats, liver, shellfish, and the like, while encouraging the consumption of foods with vitamin C, milk, water, and awesomely, coffee. If necessary, please seek additional consultation. Some employees were advised to follow up with specialists for further assessment, treatment, and clearance. Cardiologists are trained in preventing, diagnosing, and treating heart conditions. Urologists diagnose and treat diseases of the urinary tract, while endocrinologists specialize in diagnosing and treating health conditions related to problems with the body's hormones, hormonal glands, and related tissues. Eating with balance does not mean eliminating completely the foods we like, but eating them selectively. At the end of a meal, we should feel satisfied but not full and uncomfortable. Health is not about the weight you lose, but about the life you gain. Have a healthy life ahead. Thank you. This presentation is made for Didipio Community Development Corporation.